Reserve for 10 years. She is empowered to embrace life to the fullest, focusing on the here and now. She is extremely grateful to work in a field where she can inspire, encourage, and support others. In Lynn's current role as provider relations manager, she works with physicians, nurses, social workers, and the community to provide exceptional hospice and palliative care services to people throughout Northern Ohio. She coordinates outreach services and presents education to both professionals and the community. Lynn has become a leader in Lynn has become a leader in her community, known for volunteering her services to many organizations. Giving back to others is one of her greatest accomplishments. Some of her favorite volunteer experiences include, but not limited to, A Prom to Remember, the Alzheimer's Association, Meals on Wheels, and the Volunteer Guardianship Program. Lynn received a Bachelor of Science in Community Health Education from Kent University. She resides in Macedonia with her husband and 3 children. And I apologize if this cut off part of the introduction, but this is Lynn Hermensky from Hospice of the Western Reserve. Welcome, Lynn.
Hi, everyone. Thank you so much, Dana. Thank you for the opportunity for speaking today.
Yeah.
And thank you all, caregivers out there, for joining us on a tough topic to talk about. But definitely, I'm going to spend the next hour going over some helpful information on hospice and palliative care and hopefully ease any concerns or fears that you've had about the topic up until now. I really love this presentation. And we give this throughout to everybody. And thanks for all that you're doing as caregivers. It is not easy. And we want you to know that you are supported and not alone. And so, just this next hour of education on hospice and palliative care, we are hoping just to explain the philosophy, history, eligibility, and reimbursement. Talk about also not just hospice care, but palliative care, and then talk a little bit about the differences because there are differences, and even some physicians aren't aware of all the differences. So we're going to go through that today. Again, my name is Lynn Hermensky. I'm a provider relations manager with Hospice of the Western Reserve, and I have worked with the agency for 10 years now, but the agency itself is over 40, about 46 years. And we cover all of Northern Ohio. So you can see the counties listed, but we were the first hospice in the area and grateful to be locally here in Northern Ohio. So hospice and palliative care, really what it is it's comfort and compassion when it's needed most, and that is at end of life. Hospice does not seek to hasten or postpone death. So going on hospice services, which is end of life care, does not speed up hospice or does not speed up death and dying. It also does not postpone death and dying. It's a service that is there for the patient when it is needed. And care should really be sought sooner rather than later. And I'll explain a little bit more of that as we go on. But oftentimes you hear people say, I wish I would have called sooner for that support. So that's why knowledge is power. The more you know about hospice and palliative care, the more you can make an informed decision of, oh, it might be time to call in this supportive service. So, what do you think about when you hear the word? Because I know a lot of you out there right now, it's a scary word, and people do not like the H word. And I'll be honest, even before I took this position, I was even a little hesitant because I thought, oh, hospice, it's death and dying, it's going to be very sad. And I will tell you that myself and my wonderful colleagues that work in this field actually find it to just be an honor to be with people at end of life and to support people. And personally and professionally, through the 10 years I've used hospice, and it's been really a lifesaver for us. So hopefully these words that you see are what you think, but I will tell you that my friends at Vantage Aging and we do a lot of health fairs, and there's a lot of people that run past my table because they're afraid of me. So hopefully by the end of this presentation, you'll feel a little more comfortable with that word. And I know those of you in the audience today that have had someone on hospice, you understand, and hopefully are grateful for the support that you had. So we like to say it's not about giving up, it's about giving options. So a lot of times people hear the hospice word and they think, oh, she's giving up, she's going on hospice. But we like to think of it as you're not giving up, you're taking control, and you're looking at what options you have available to provide quality of life at end of life. Hospice support really offers a holistic approach to symptom management when curative treatments are no longer an option or when curative treatments are no longer a choice. So people that say, I can't do this anymore with current treatments that they're going through, or people that it's no longer a choice, that is when they choose hospice care. And so we help physicians and other healthcare providers achieve improved outcomes for patients facing serious illnesses, along with their family members and what wishes they want as well. We really say that the patient is in charge and we're just there to support them throughout the journey. The greatest fears associated with death and end of life in getting diagnosed with an illness are being a burden. You know, people kind of think that right away. They don't want to be a burden to their family. They don't want to be in pain. They don't want to lose control, and they don't want to be alone. And hospice and palliative care can help address all of those fears and kind of jump right in and be side by side to make sure that doesn't happen. A couple other fears: dying at home. Some people don't want to pass at home, so there's definitely options available to them as well. And 90% of adults believe it is the family's responsibility to care for the dying. But as you all know, being a caregiver is a hard job. It is 24/7, and you need people to help you. You need supportive services, and that is what hospice and palliative care can help with. To be eligible for hospice is you have to have an advanced illness. So you have to have a diagnosis of an illness, and it can be heart disease, lung disease, it can be Alzheimer's, dementia, ALS, it can be renal failure, cerebral vascular. We even had people on hospice that were battling COVID. So just helping people that have an advanced illness are really struggling at end of life. They have to have physician certification. So you don't have to decide if someone is eligible for hospice. I don't have to decide. The patient doesn't have to decide, but a physician says that, yes, it is time for hospice or palliative care. For hospice, it's usually months versus years. So the Medicare guidelines are 6 months or less. And that's usually a physician who is saying, you know, with the prognosis, with the diagnosis, we're looking at about a 6 month longevity for the patient. However, at 6 months, we don't just say, okay, today's the day. We know that nobody has a crystal ball and knows when this is going to happen. So hospice can go longer than that 6 month period as long as they're still meeting eligibility. We have had people who have graduated from hospice care, meaning they are doing well and they no longer have that 6 month outlook and they come off of services. And that's a great day when they come off of hospice services. We also have people that continuously meet the criteria and can be on hospice for years. So at that eligibility, it's usually that 6 month or less, but it's not a hard 6 month number. So as long as they're meeting that eligibility. Hospice is for people that cease curative measures. So people that are saying like, I am done getting poked and prodded and medical treatments, and I just can't do this anymore. Or when curative treatments, like I said, are no longer an option. Hospice can be any age, so pediatrics to geriatrics. We will take care of any age, any diagnosis. It's really a wonderful service. And I've had friends and family too that have needed it for younger people. And I'm so grateful that we were there to offer services for them. And you have to desire hospice care. So during the pandemic, I answered some calls, some referral calls, which was a great experience for me. And I did have a couple family members say, I want you to come take care of my loved one, but you can't say that you're hospice. And we said, we have to be honest of who we are and why we're there. And we all have to have the same goals in mind. We often find that the patient themselves is okay with having hospice come in, but sometimes the family is a little uneasy again because that word hospice and the scariness of it. And we'll go into some myths and facts in a little bit, but they have to want us in the home. So to say, yes, I'm okay if they come and offer support. On the flip side of this, too, hospice can go away at any time as well. So either if they get better and hospice is they're no longer eligible, or if they decide to go back and maybe get some curative treatments or just decide hospice isn't right for them at the time, they can come on and off services at any time, which is something that I didn't know when I first got into this. So just so you know, people can come off hospice. How is it covered? So hospice is a wonderful program because it's covered by Medicare, Medicaid, traditional insurances, private pay, other funding sources. And I know our agency, we do a lot of taking care of people regardless the ability to pay. So we'll help anybody that needs hospice services at any time, which is a wonderful, wonderful support. The services covered pain management and symptom control. And if you remember, that was one of the fears that people have. And so we take care of that. We also have a lot of great non pharmacological ways to take care of pain and symptom control, which I love. So we have Reiki and massage, music therapy, laughter therapy, a lot of different things in addition to any pain service management services that they would need. 24/7 telephone access to services and support. So anytime anybody needs us, they call us 24 hours a day, 7 days a week. We have a team ready to go to answer questions, to evaluate, and to offer that important service. And I think this is important for caregivers to know that you have somebody that you can call at any time. I'm a question asker. I ask questions over and over. I want to be in the know, and we have a team ready to go to help support 24/7, which is wonderful. All medical equipment, tests, procedures, medications due to the hospice diagnosis are covered through the hospice benefit, which is amazing. All nursing care, instruction for caregivers, loved ones is included. So we will come to the home, come to the facility, not only provide the great supportive hospice services, but then also teach our caregivers how to be able to take care of their loved one at home, which is an important thing for people to do. Social work is available to help set up with community resources, kind of touch base on what services are needed, check in on people. We have our great state tested nursing assistants in hospice that will come and do things like bathing, dressing, some, help with things around the home and help with things with the patient, which is great. Volunteer support and companionship visits. These are the angels on earth, our volunteers. I know our agency has over 1,000 volunteers that can do anything from volunteer hairdresser, volunteer attorney, walk pets, pet therapy, art therapy, music therapy. Wonderful, wonderful volunteers that can come and just talk with people, sit vigil with people, do some light housekeeping, build a ramp. The volunteers can do a little bit of everything, which is amazing. We couldn't do what we do without them. And if there's any volunteers in our audience today, thank you for everything that you do. Your support is amazing. Spiritual care is assigned to every patient to help them spiritually. Expressive therapy, again, art therapy, music therapy, massage therapy, laughter therapy, pet therapy, wonderful therapies that are available. And then we also have grief support. So once a patient passes away, we don't go away. We stay around to support not only the caregiver, but anyone involved, family, friends, neighbors, anybody who needs that good grief support. And we also offer bereavement camps for children as well. And it's just a really wonderful program. The team is transdisciplinary, meaning everybody is involved. We meet weekly to discuss the patients and one-on-one with the family and the physicians to kind of talk about how the goals of care are going, how everybody's doing, and what other needs might be warranted. I know that we all, like I said, we meet and we do have physicians that can oversee all of the patients, but people can stay with their own physician as well. So just by going on hospice or palliative care, you don't have to give up your doctor that you've been with for years. You can stick with them throughout your team. Like we said, everybody's assigned a registered nurse, a social worker, hospice nursing assistant, spiritual care, pharmacists, physicians, advanced practice nurses as needed, volunteer service managers, and our wonderful volunteers, all of our expressive therapies and bereavement coordinators. And these can go wherever the patient resides. So if they're at home, this team can see them at home. If they're in a nursing home or assisted living, we can visit them there. If they're in an apartment, wherever they are. And there's also some hospice houses, which I'll talk about in a little bit. But this team goes to where the patient is. Also, real quick with bereavement coordinators, just so everybody knows, we tend to stay and support the bereaved, the caregivers, at least 13 months. And we do that so that we can get everybody through the first birthday, first Thanksgiving, all the holidays to kind of get them through the 1 year anniversary and then the 1 year anniversary of the death. Some people with bereavement are after 2 weeks, they say, you know what, we're fine. You don't have to reach out. And we say, we're here if you need us. Some people we've been seeing for years and years, and we're here as needed. We also offer support groups, not only to our patients' families, but also to the community as well. So keep that in mind if you know of anybody grieving out there. We have some great support groups that people might be able to take advantage of. So it's a whole team approach, working closely with our patients, their loved ones, and doctors. Our teams develop individual care plans that focus on aspects of physical, emotional, and spiritual well-being. So we are looking at the patient as a whole and seeing how we can support them at end of life and give them quality of life at end of life. There's some exclusive programs that our hospice does. Every hospice is a little different. And just so you know, there are probably over 60 different hospice companies in the area. What we recommend is to meet with a couple different hospices, see what programs they offer, and see what support they might provide. We always say, hospice should be patient choice. So absolutely, whichever hospice you want to go with is your choice. So don't let somebody kind of say, oh, you have to use this hospice. Definitely ask questions and be your own advocate and go with who you want to go with. I like to point out these programs though, because I like, when you're hearing about what hospice can do, I think kind of diving in and hearing some of the wonderful supportive programs makes it sound even, you have your nurse and your clinical team that's coming in, but some other programs that are available. For our veterans, we have our Peaceful and Proud program. So anybody who has served our country, we definitely want to support, and we make sure that all of our veterans are thanked and given pins and certificates and given any extra care that they would need. We have veteran volunteers that will come and sit with them at end of life and talk about anything that they want to discuss and talk about. We see a lot of PTSD with our veterans, and we want to make sure that end of life is meaningful and supportive to them. Our Pet Peace of Mind program, which I love, is anybody who is at end of life who has a furry friend, or I guess a slithery friend, whoever, any pet that you have. The last thing that we want to do is say, you are ill and you're unable to take care of your pet anymore and your pet has to go away. We make it so that we have volunteers that will come and walk dogs. They will buy kitty litter. They will take animals to the veterinarian, and we promise to rehome the animal when the patient passes. So they don't have any worries. They can be with their pets until the very end of life. And I love that program. Moments to remember at for end of life hospice patients is asking people, what is one more thing that you want to do or see or be a part of? So we have taken people to Cavs games. We've gone on fishing trips. We've gone to casinos. We had a young patient that wanted to be a chef. So we were able to partner with a restaurant where she was able to cook meals and have her family come in and eat her food all together. That was a wonderful program. We had a woman who was a big Cleveland Indians fan, and she wanted to go to the last game before the Indians became the Guardians, and that was wonderful. So she was able to go to that game as well. So really, anything people want to do, it. We just had a program, somebody who was real involved with the Grand Prix, and they had a Grand Prix party. I've seen ponies going to nursing homes. I mean, there's sky's the limit. Anything people want to do at end of life. And this is another reason we say we want people to get on services sooner than later, as long as they qualify, so that we have time to plan these wonderful events for people. Flight to Remember, this is a great program. As people approach end of life and they might become bedbound and they're not able to get up and about at end of life, but they still want to see something that they haven't seen for a long time. So our Flight to Remember program, it's all free. It utilizes drone technology to fly people to a spot that they still want to see. So we had a flight that went to Punderson Park, where a family used to camp, and they were able to view that area. We had a family that built a log cabin in Pennsylvania, and we were able to fly the drone just up the driveway like they were driving up the driveway and fly around. They were able to see their home again. We had a patient whose family grew up in Italy. So we were able to partner with a drone in Italy to do a flyover of their hometown. And we recently had a woman who wanted to see her husband's gravesite on his 1 year anniversary of him passing. And we were able to take her to the gravesite flying with a drone. So again, it's all free for our patients. The family can be a part of it. And I believe we also record those programs for the family to keep forever. It's a great program. Community bereavement and grief services, we talked a little bit about that. Support groups for not just our families, patient families, but for the community. Any grief services that people need help with, we can send counselors in, and then also the kids' bereavement camp. So throughout the year, we have support for the kids as well, either through crafts or with horses, like really great programs. And then we have our end of life doula program. So you might have heard doula for births, where they plan the birth and plan how they want the birth to happen and what music they want playing and what smells they want in the room. And the end of life doula program is very similar to that, but it's for end of life. So asking our patients, where do you want to pass? What music do you want playing? Who do you want by your side? Also looking into things like legacy work and saying, what do you want to do with your photographs? Do you want to write your life story? What can we do with those handwritten recipes? And really becoming clever and coming up with some great ideas of some things to leave behind for future generations. So the End of Life Doula program is a wonderful, wonderful supportive program. So moving on, hospice is available anywhere. So a lot of times people think hospice is a place, but it's not a place. Hospice is a service that goes wherever. So we have pictures here of a hospice house, a home, a trailer park, a nursing facility, anywhere people want to go. We've taken care of homeless people before, and we're able to utilize our resources to get them free housing and support. And I've really seen some amazing things in my 10 years. We also do have, like I mentioned, there's hospice houses throughout the area. So if a patient does not want to pass at home, which sometimes they don't, because they don't have the resources available, or the family does not want the death to occur there. They can go to a hospice house, and those are located, the four that you see here. One is in Westlake, Ohio. One is in Euclid, right on the lake. One is in Medina, and the other is in Sandusky. So there's hospice houses throughout. There's also a few other hospice houses um, in the area, one in Akron that I know of, one in Parma that I know of. And the hospice houses are there to support somebody at end of life. They are also there to support somebody who needs symptom management but does not want to go into a hospital. Once you come on hospice services, you don't really go into the hospital anymore. So our team supports people where they are. If they need that additional support, they can go to a hospice house instead of going into a hospital. And finally, the hospice houses are utilized for respite care. So another great benefit of having someone on hospice is if the caregiver needs a break, the patient can go on a 5-day respite stay, either to a hospice house or to a contracted nursing home. And just to kind of get a little, the caregiver gets a break, and sometimes the patient gets a break too. So now we're going to talk about palliative care. And palliative care is another end of life program, but it's not quite to the end of hospice. So both programs, you have to have a terminal illness and advanced serious illness. So you have to be diagnosed with something. Hospice is no longer seeking curative treatment. So again, we already talked about that. People that are like, I can't go through anymore. Whereas palliative care folks can still be getting curative treatment. So they can still be getting dialysis. They can still be getting chemotherapy. They can still be getting other treatments for their illness. Hospice, we talked about expected prognosis of less than 6 months. So about 6 months or less. But again, it doesn't stop at 6 months. It can keep going. Palliative care, no eligibility criteria. So on palliative care services, you can be on it for years and years and years. Hospice is covered by Medicare Part A, which we talked about. Palliative is covered by Medicare Part B. Palliative care is also the comprehensive interdisciplinary care of patients and families facing an advanced serious or terminal illness, focusing primarily on comfort and support. So people that are diagnosed, they're not quite ready for hospice yet, but they do need comfort and support. Palliative covers that comfort care. It controls pain and symptoms. It addresses psychological, social, and spiritual issues. It provides disease-specific education. And a lot of times when you're diagnosed with one of these illnesses, knowledge is power. And knowing what is coming, what to expect, what to look for, what is normal, what's not normal. So we help people navigate through that. And we assist patients and family to achieve the best possible quality of life. So looking at their illness, focusing on what their signs and symptoms are and how we can kind of alleviate that and relieve them without having to go on hospice care, because it's just not the time. I've often referred to palliative care as kind of a pre-hospice program. Eligibility, again, they have to have an advanced serious illness. They have to be experiencing a debilitating symptom. So they have to have something that's bothering them, something that's making it difficult to remain at home, something that continuously sends them to the doctor's office or the emergency room. So you can't get diagnosed with an illness and say, I want palliative care right out the gate. I mean, you do have to be struggling with a symptom. We do also have a physician order required for that. And palliative care can be any age as well. So think about the loved ones that you're caring for. Are they, are they in and out of the hospital? Are they constantly, complaining about symptoms? palliative care might be a great supportive program for them as well. It's covered by Medicare, Medicaid, insurances, private pay, and some copays may exist because they do utilize nurse practitioners. So when a nurse practitioner goes and visits your loved one, usually the copay is whatever you're currently paying your physician when you go to a physician visit. So, patients with serious illnesses are really looking for that good pain and symptom control. We don't want anybody to be in pain. They also want to avoid inappropriate prolongation of the dying process. So, they want to, like I said, they want to live out their life quality of life without really focusing as much as quantity. So, they're really looking at quality of life. They want to have a sense of control. So they want to be able to say, yes, I want this treatment. No, I don't want it. Yes, I want this service. Yes, I would love an aide to come into the home and help with this, but maybe not spiritual care. Yes, I want spiritual care. Maybe I don't want an aide. So we want the patient to have control of who they want by their side, how they want to live out their life, and what decisions they want to make. Um, we definitely want to relieve any burdens on family. It is very stressful and it is hard to make decisions. It is hard to be there 24/7. So, to have an additional care team to work with you and your loved ones on, let's talk about all the options out there. And again, before I got this job, I did not know all of the supportive services that were available. Um, and that's why we're grateful to Vantage Aging for having programs like this, because just knowing that you do not have to be alone through this journey. And then it strengthens relationships with loved ones, because if hospice can come out and provide wound care, help with bathing, help with dressing, then you get to spend quality time with your loved one and not having to do as much as you've been doing. It can be very hard. So palliative care is an effective solution because we have experts that will come to you wherever you are to help manage what's going on. They can help with decision making. They can avoid those unnecessary visits to the emergency department and really support caregivers and act as partners in care. So when somebody is diagnosed with an illness, you know that you do not have to be alone. You have people that will hold your hand and help talk things through and help provide care when you need it. When to refer to palliative care? When there are symptom management challenges. So again, if your loved one's at home and doing great and you're doing great, now's not the time to call. But if you're noticing a lot of added symptoms, if you're noticing, people in pain, a lot of nausea, shortness of breath, people just really struggling to get around, weight changes, loss of weight, that might be a good time to call just to see if they might be eligible. Also, when standard medical care is increasingly viewed as futile or no longer desired, that's a good time to call. Patients' declining health is creating difficulties for continued dialysis. That's a good time to call. When the progressing debility leads to decreased quality of life, we want to focus again on just good quality of life at end of life. And I love when people do come up to me at fairs, or they'll call me and say, I had such a great experience with hospice care. My loved one had a beautiful death. We were all there. We were supported. The patient was comfortable. I think that's great. So, when people want to focus on that quality of life. And then when assistance is desired in advanced care planning and decision-making process, again, you don't have to do that alone. The palliative care team, which is called Western Reserve Navigator on our end, is there to support. Oh, there it is, Western Reserve Navigator. We offer a medical and a social model of care. So people can have those advanced practice nurses, social workers, and volunteers as a part of their care team. I will tell you that palliative care and hospice care, another difference is hospice has a full team that comes a little more frequently than the palliative program, but they do have they are able to, again, have nurses, social workers, and volunteers come out to offer that support, kind of get people settled, and then follow up as needed. So they can connect people with a life altering diagnosis to the appropriate services and provide symptom management, even while the person can still be getting treatments. So I think that's very important to know. So now we're going to go into myths and facts because there are so many myths and facts about hospice and palliative care. And I hope at the end of this program, those are cleared up for you. And you can also be an advocate for other people that might be facing the need. Myth number one, hospice is only for cancer patients. So I think for years and years, that is what people thought. But the fact on that is hospice is available to anyone with a life-limiting illness, regardless of diagnosis or age. So depending on what they have going on, cardiopulmonary disease, cancer, cerebrovascular, Alzheimer's, renal, endocrine, cardiovascular, anything that somebody is really struggling with, we can help them with hospice care and work through that. Number two, this is probably the biggest myth is that hospice means giving up hope. And even with my own family members, one time the word hospice was mentioned and they were crushed. They were like, why did the doctor bring up hospice? And I had to do some education just saying that doesn't, I mean, we can still have some great time left with your family member. Hospice doesn't mean giving up hope. It kind of means the patient takes charge and decides what they want for quality of life. And again, I've known people on hospice for years. So hospice redefines hope with focus on living life as fully as possible, comfort, achieving final goals and last wishes. So it's not giving up, it's kind of taking charge. And how do you want to live out your life? Hospice is a place. A lot of people think of that. They say, where's your hospice at? And while we do have hospice houses, hospice itself is a philosophy of care provided wherever the patient lives. So we will go to wherever that patient is. There are hospice houses, but if you're looking at hospice, you can decide, we want to go to a facility, we want to do it at home. All the equipment can be brought in and people can, as a matter of fact, I think the last stat I heard was about 75% of our patients were in the home environment. Hospice is expensive. Everything seems to be expensive these days with healthcare, but hospice is a covered benefit through Medicare, Medicaid, insurance, and everything due to the diagnosis is is a covered expense. So the care team that comes out, like I said, medication due to the diagnosis, equipment. So oftentimes hospice can, I don't want to say save people money, but provide these wonderful services that people don't have to shell out a lot of money for. So it's really covers a lot of things. And there it is. Hospice is paid for by Medicare, Medicaid, and many commercial insurances. It makes me think of a story. One of my mom's friends' husbands was in a hospital, and they kind of said, there's nothing more that we can do. And she did not want him to pass away in the hospital. Most of us don't. And she said, I want to get him home on hospice care. So we were able to make some phone calls and all of the equipment was set up in the home, any medications needed, the transport to and from the hospital to the home, and her and his wishes were granted by he was able to leave the hospital and get home. And this all occurred in the wee hours of the night. And he was able to get his wish and pass it home, which was awesome. Myth number 5, if a patient chooses hospice care, the only outcome is certain death. And you think that you hear like, oh, he's going on hospice. And everybody thinks, oh, he's going to be gone in a week. But some patients improve with hospice care and leave the program. However, they can be remitted if their condition declines. And I sit in those meetings that I talked about every week. And every week, it seems like one or two people are coming off hospice services because they have improved, which is great. So if it's not their time, it's not their time, but they certainly can come back on hospice services anytime there's a decline. So if you've known of someone who has graduated from hospice, if there's any changes at all, we can always come back on. So I think that's very important to, I think that's very important to know. The other thing I wanted to mention, a lot of times people are so afraid of hospice, they would rather not call at all. And sometimes putting them on the palliative program, even though they might be eligible for hospice program, sometimes putting them on the palliative program and then having them educated on what we can do kind of eases them in. So, but I think it's great that some people can come off and some people can be on for some people have been on for years just because they keep meeting that eligibility. I will tell you though that the average length of stay for hospice is really just a couple weeks. And I think that's because people wait so long to call. So the sooner you can call, the more benefit people can get to the services. Myth number 6, hospice care is for the only last day of life. A lot of people think that, but it's a journey that takes time and energy. We just talked about this. Referrals are often received so late that it is difficult or even impossible to achieve end of life goals. So we even have these education programs with physicians saying, when there's nothing more that can be done, let's get them on hospice services sooner. If they get better or if a new treatment comes about, they can always come off services. So, myth number 7, patients cannot receive curative treatments while receiving hospice care. So, let's see if you were listening. Patients can discontinue hospice to seek curative treatments and return once they have completed them. So, if something new pops up, and they think maybe hospice wasn't the right choice, they can come off of hospice services, go on palliative care services, and get those curative treatments. So it's not a final, you signed up, it's nothing set in stone. Hospice, we will do anything, we will move mountains to make sure people are comfortable and they're getting exactly what they want at end of life. Myth number 8, we just talked about this. Hospice care is limited to 6 months. Patients may receive hospice care as long as their conditions warrant such care. So we'll keep going as long as they need us to. Myth number 9, only a physician can refer an individual to a hospice program. We're going to go to that fact. Anyone can contact hospice to initiate a referral. So it does not, while the doctor has to sign off on it, anybody can call in. So the doctor's office can call in, the hospital can call, you can call for your loved one. Like I said, during the pandemic, I was answering referral calls, and sometimes the patients themselves called in. And I said, I know this is a hard call, but now that we're linked, you're going to be supportive. And so anybody can call. I've had people call because they were concerned about their neighbor. You can call 24 hours a day, 7 days a week. And the initial appointment is an educational, assessment appointment to see if the family and the patient want hospice services, and then we can proceed from there. But it doesn't cost anything to have somebody come and just do an educational. We can even do educational talks over the phone just to let people know about eligibility and talk about each person. But anybody can call. And then from there, we can call the physicians to get the approval. So again, here's that tagline. It's not about giving up. It's about taking control and doing what you want at end of life and how you want to live out your life in the best quality of manners. According to the National Hospice and Palliative Care Organization, people live an average of 32 days longer with hospice support. And I think that's because they have the equipment that's needed, the knowledge that's needed, and the support services that are needed. Families usually say, I wish I would have known about your services sooner. And that's hard. They say, I wish I would have called sooner. Mom could have been on this months ago. I've even known some of my own family members, which is hard now that I'm in this, that I said, oh, we really should have reached out for them. I'm grateful to work with, Northern Ohio's most experienced hospice provider. Again, we've been in the area for over 46 years, and this is all we do is hospice, palliative, and bereavement care. So I have learned so much about hospice and palliative care, and just grateful that you're all also getting this education because it's a scary topic. And I almost didn't take this role because I thought, oh, my job is going to be, it's going to be difficult. It's going to be sad. And I can't tell you how rewarding it is to be able to support people at this very important time of life. So modern day hospice was founded by Dame Cicely Saunders, and she was a physician and let me think. She was no, yeah, English nurse and social worker and physician. She was a very, very educated woman who said a life ended with much unfinished business or uncontrolled suffering has not been met with due respect and does not leave good memories. And she was from England, and she had a dear friend who died a terrible death due to cancer. He suffered, he was, miserable. He didn't have choice of what was happening. He kind of lost, control of everything. And she watched this happen and said, no way, we can do better than this. And so, again, it's true. Anybody that we've seen in our life who has just not had support, not had pain management, not had family by their side, it can be really tough. And so I'm grateful that every day I can go out in my job and help link people to services. So I'm going to end on the question page, and I don't know if we have any questions in the Facebook link or not. I will turn that over to Dana or Amanda. But while they are looking, I just want to say, again, you can call anytime. Know that these services are available. Even if somebody comes out, a company comes out and says you're not eligible for hospice or palliative care right now, you might be in the future. And it's just I say better to have us and not need us than need us and not have us. And so I'm grateful to spend the last almost hour talking, and it's a tough topic. So thank you for listening.
Thank you. I think that it is a hard topic, but I feel like you present it so well, and I think knowledge and understanding makes things a lot less scary
Mhm.
for people. So things like this are really helpful in helping that. So we didn't have any questions.
Okay, great.
I had a comment though that I wanted to say. I really appreciate the creativity of using the drones and like how technology
Yeah.
can help people experience something where they can't maybe physically be there, but to actually experience that. I was like thinking of like going to somewhere you love and like going down the driveway to the house that you love, spending time there. That's really meaningful. So that's amazing that that's been used to help people.
Awesome. Yeah, it's awesome.
Yeah, I love that. So the creativity with that and things like Reiki and massage are
Mhm.
wonderful. Of course, the pain management part of medication is great, but also having um, alternative ways to help with pain and maybe also some spiritual things that might be going on with the patient. I think that's a wonderful service.
Yes, yes. Awesome. Very good.
Well, thank